many times people come in with a innocent prescription for a blood pressure for your blood pressure. But we now, after years of research and talking about it and digging into it, that sometimes blood pressure can be a simple thing like a mineral deficiency, which might be caused by your heartburn medicine that you're taking over the counter. People start with that innocent blood pressure medicine just to come back the following year for a cholesterol medicine and for a prescription medicine for their heartburn. The next thing is a diabetic medicine because the statins cause diabetes. They come into the pharmacy. I'm on this list of 17 medicines. Which ones can I drop? Here we go. Episode number 2. Yvette, how are you doing?
Very well, thank you. Super excited. I do believe the time and the place to get people from pills to purpose has never been better than now. Let me put
Absolutely.
it that way.
100%. I think the ground is laid, and especially in times like this, this is 2025 going into 2026, and if anybody listens to this, they would know there's this big scare of healthcare prices increasing, and I believe this is a place where you can learn the things that you can do by yourself or get another perspective on how to improve things for yourself. So last week we talked a lot about our journey into pharmacy school and out of pharmacy school into what we're doing today in the pharmacy. But I think what all our listeners want to know is how did it get to us actually moving from pharmacy, where it's only drugs and science and all allopathic medicines, into functional medicine, where we talk more about nutrition, supplements, exercise, and stuff like that. If I may ask you, Yvette, what event in your life would you say brought you to that point to say that this can't be all there is?
It's such a good question, because many times when I counsel patients and they get to some other big revelation of something they've been taking that's causing side effects, and they're really heartfelt and happy. So many of them will say to me, but why does my pharmacist not know? Why does my doctor not know? And something I've learned over the years is if you want somebody to help you, you got to speak to somebody who's been through some stuff. I'm not saying go pick the sickest person and go ask them. No. What I'm saying is most of the time, for example, like if you're a young mother and you're nursing, don't go ask a 19-year-old who's never had a baby how to help you. Ask somebody that's done that. And the reason I say that is because the amount of doctors, pharmacists, functional medicine practitioners, when you ask them, where did you get to this point? What happened? It was either something in their own life, their husband, their wife, their children, and that's what made them look for deeper answers. I remember always, like I said last week, I was very intrigued with medicine, the role it played with my mom's sister who had multiple sclerosis. But there was a time, it was around about 2008, 2009, when my mom had some very serious issues with her iron levels. She couldn't come and visit us. They wanted to give her a drip. But funny enough, I am a pharmacist, but my mother would always say she's going to go speak to her pharmacist. So I had to have a good laugh about that. And when she arrived at the airport, I honestly thought, what are we going to do if she dies here? That's how bad it was. She was pushed in on a wheelchair. I was devastated. I could not think what's going on. Here's my mom. She was a ballet teacher, danced, jumped, taught, did the split still. She was 75, active, and she's coming in here in a wheelchair and she can barely stay awake. It took a few days to get some information out of her to see, what are you on? What medication are you on? And every day we got another drug. Finally, I got the whole list. And that's when it hit me that drugs do have side effects. But there was also a couple of nutritional deficiencies that these drugs cause that we don't look at. And when two different doctors prescribed her the same thing, back in South Africa, the PPIs would be sold not under the same name like here in America, where omeprazole, you get omeprazole, you get esomeprazole. There, it had two different names for the same thing. And subsequently, when I started delving deeper into this, reading up, studying, finding out that the actual nutrient deficiency it's causing for her inability for her body to absorb these nutrients was causing her anemia to the point where it was serious. And this opened up a whole new avenue. So when you look at pharmacy, are aware of, in pharmacology, of the side effects, the nutritional deficiencies. We don't always learn how to complement those. Then you go a little bit integrative and you see, okay, fine, this is going to help with that. But as soon as you start diving into functional medicine, you start realizing, okay, this drug doesn't just cause this side effect. You really don't need this drug, because if you do A, B, C, and D, your problem is solved. So that's the progression that I took, where really going in deeper and deeper and realizing, for example, a drug like omeprazole, PPIs, those things were developed for people to take for 6 weeks to 3 months, get all the nutrient deficiencies right, get the diet right, and stop it. We are now at probably about year 30 that some people are taking this. So part of my train of thought was starting to go, okay, so besides helping the people that are on those with the nutrient deficiencies, how can I get to help people to get either off them or never go on them? So that's how my progression from 2008, I can remember as clear as day when I opened up that information sheet from the drug manufacturer. And I don't think any patient opens it up, because my desk wasn't big enough to open it. And starting to read in there, and every single thing that patients are struggling with is documented in there, as clear as day. So that
As
really,
big as your desk.
yes.
And the writing, you need 2 magnifiers to be able to read it.
Exactly. So there's a lot of stuff in there. And I honestly felt like the industry had lied to patients. First of all, we're not disclosing all the information. So to come back to the same old question I get always is, how come my doctor didn't know? How come my pharmacist didn't know? It's because if you don't take the time or have the desire to walk down that avenue and learn more, you're not going to. You're just going to skim the top. You're going to say the line that needs to be said. But if it doesn't personally affect you or your family, you won't change.
Also want to add, not to throw any pharmacist or doctor under the bus, but these guys work hard. They're really busy. So they can barely find the time to do their required continued education for their licensure, let alone going to search for things outside of the box. So they'll probably at a minimum do their continued education, which is all sponsored by who? The companies that make the drugs, just in order for them to remain licensed. And then remember, these are people that being a pharmacist or a doctor is their job. They still have lives outside of that office. They've got families. So, and now in order to do some extra research means they will have to take time away from their families who they barely see. So I don't want to bash them, but when I've heard somebody saying something, and the example you mentioned for yourself, Yvette, is so clear as daylight. Sometimes it has to hurt enough in order for you to step out and do more and go search for more. So don't blame your pharmacist or doctor for not knowing these things or not even mentioning it to you. Because when you go to see them in the pharmacy or in the doctor's office, they also have a limited amount of time to talk about it.
I always encourage patients when I speak to them to ask the right questions.
Yes.
So if you can see that the questions aren't being answered, we do live in an information wealth at the moment, also a lot of disinformation. But you can certainly ask the right questions. If you don't get any answers, then you've got to move on. You've got to find somebody that helps you. And I totally agree with you. Not everybody has the time and the inclination, but when it really hurts and when you see somebody suffering, then it makes things totally different.
Yeah. And I have to say, my personal journey, as you know, we started having babies only after the age of 30. And then when my youngest was born, I realized by the time he's 18, I'll be 60. Many people retire by that age. And I thought, you know what? I need to start doing something for myself right now in order to keep my body going until he's at an age where he's going to probably get in a lot of mischief and I need to be able to go and support him. So for that reason, I also listened to a doctor recently who mentioned something, and it was just a light bulb that ties into what we're talking about, is a lifespan. And allopathic medicine is so focused on extending lifespan, but not necessarily health span. And I feel this is where functional medicine comes in. From all the research, it was a long road. I mean, I took my medicine religiously and I thought, okay, well, I just need to work out more. And 2 hours on the treadmill and my knees not liking that, I decided there must be something more. And that's where I decided to also look for more, because this can't be it. And I have to say, now we went into integrative medicine, into functional medicine, and we know a lot more. Personally, I feel younger than I felt 10 years ago, but also I feel even that we're just scratching the surface.
Yeah. And, I always like to tell people that I don't have all the answers, but I know where to find them. And because we have both of us have such a desire to learn something new, to find out something new, that we never stop. When somebody tells me, they know it all and they read off their qualifications, then I'm already scared. Because I really do believe that I don't know everything, but I learn every day. And if I find another challenge, we step into that. And something I mentioned to you, what we spoke about last week as well, a concern for us. We have two kind of different stories of what happens to us. Now, give us a little bit of an example, Johann, of people that come to the pharmacy. You know them, you meet them, you see them. They arrive there with one prescription. And how does the story go?
Yes, I have to say, and I feel there's a lot to say about what these medicines actually do to you, because there's many times people come in with a innocent prescription for a blood pressure for your blood pressure. But we now, after years of research and talking about it and digging into it, that sometimes blood pressure can be a simple thing like a mineral deficiency, which might be caused by your heartburn medicine that you're taking over the counter. But besides the point, the progression that we see on well, it's not daily because it progresses over years. People start with that innocent blood pressure medicine just to come back the following year for a cholesterol medicine and for a prescription medicine for their heartburn. And it just progresses. The next thing is a diabetic medicine because the statins cause diabetes. And then they've got a diabetes and a statin, a cholesterol medicine, a blood pressure medicine. Next thing, they start forgetting something, things too much. And then there's a dementia medicine. It just goes on and on and on. And before you know it, before they're 70 or 80 years old, they come into the pharmacy. I'm on this list of 17 medicines. Which ones can I drop?
And this is also ties in very much with cost. Because
For
it's
sure.
only, I feel, that thing, if it doesn't hurt. So only when it starts hurting somebody's pocketbook do they start asking questions. There are people that if you ask them, have you been feeling good the last 17 years? Oh no, I feel like crap. But now that I can't afford it, now I'm going to ask.
True. That is very true. And well, I've got a customer, the sweetest man, and he actually started to really feel like crap. I don't know any other words to describe it. I know other words, but it's probably not appropriate for this podcast. And because I can use the words he said, but then we're probably off of this platform. But anyway, doing a review of his medicines, I saw he was on several cholesterol medicines. Why are you on 4 different cholesterol medicines? Does your doctor know you're taking 4 cholesterol medicines? He says, well, he's the one prescribing it to me. And I told him, okay, I made a list of it for him. I said, you go to your doctor and see if you can drop these 3 out of the 4, because this is a reason you can't get up in the morning. This is a reason if you're weak in your muscles, you can't move around. And we talked earlier about deficiencies that medicines cause. What is the number one deficiency cholesterol medicines cause?
CoQ10 shortage.
CoQ10. And what does CoQ10 do? It gives power to your muscles, for one thing, where he says he can't get up because he doesn't have the power in his muscles to move around. So he went to the doctor, dropped those 3 medicines that I suggested. Now he's only on 1, which I still feel he doesn't need to be on it. And he feels a lot better.
Amazing.
So There's so many stories that we see on a daily basis where medicines are prescribed to mask different side effects, and also where there's interactions with other medicines that cause you to not feel that great. But unless somebody is going to back down, and especially in the position that Yvette is in, to really go down every medicine and see why people are taking it, especially this is now an integrative way to see, do you really need it? Can you drop one of them?
Well, the interesting part about that is when I do actually go through a clinical counseling on all the drugs, and I would ask some patients, what are you taking certain things for? Most of them don't know. And I don't blame them. Okay, they're all funky names. They all want to know, how do we remember those? But certainly, if you are taking something and you've been taking it for quite a few years, you've got to have some other understanding. And I had an example this week of a lady that was asking me about one of her medications because she was dead sure this drug was causing side effects. After spending about 40 minutes going through everything, looking at all her other medications, I realized that she had an absolute liver overload. And she was heading to something that's like Stephen Johnson's, where it's very dangerous. It can kill you. And the signs and the symptoms were there and everybody's ignoring it. So sometimes it's quite how can I say, like really relieving when you help a patient and you go through stuff and you give them an answer and you say, but surely, when did this start? And then when you ask when medications were started and you look at that, you kind of get an idea. But the one thing that you and I both were talking about, what you mentioned now with regards to the statins and the statins causing the deficiency of CoQ10, which is written on the literature that if you do take it, please advise your patient to take the CoQ10. So it's not something you and I are making up. Something I want us to speak about that I probably think 99% of patients that we deal with are on. And those are our beautiful PPIs, the proton pump inhibitors. And we can take it for, why people use it. This is the drugs that they use for reflux. It's like omeprazole, the Prilosec, the Nexiums, the pantoprazole, a whole line of them. And the train of thought behind using those, and then we can start looking like Johann and I would see, but in functional medicine, that is counterintuitive for getting your body to heal. So first of all, if you are on one of those and you recognize those names, Johann, I want you to explain to people how, with regards to the inhibiting of the acid production, what is going to be affected most in our body? What nutrient deficiency are we going to get? And what all does that cause? And we can elaborate a little bit on that.
Yeah. And one thing that you have to realize about these, especially the PPI type of drugs, I'm not talking about the H2 blockers now. The PPI blockers, it's called proton pump inhibitors. So there's a proton pump in your stomach that produces and secretes the acid into your stomach to help you to digest the food. So what these PPIs do, they literally go in and they shut it off. It's not like, okay, we're just turning down the volume a little. It shuts it off. So the acid in your stomach is important for multiple things. One thing is you're complaining about your acid reflux, and now you take a PPI. The sphincter on the top, the little valve on the top of your stomach that goes into your esophagus, where this acidy fluid is pushing up, that's causing the discomfort, is controlled by the acid content of your stomach.
So counterintuitive.
The higher the acid content, the better it closes. So now if you shut down that acid pump, is that valve still working? Probably not so much. But now we're talking about nutrient deficiencies. The number one thing that you need in your stomach to absorb minerals is acid. So think about zinc, magnesium. Zinc and magnesium is probably my two favorites. I talk about it in the pharmacy probably every day. I would say probably every day. Now you can take the supplement, but if you take the PPIs and you shut off that acid in your stomach, you can take that supplement, but your level of absorption is going to be very little, very little. So if you do take a PPI, then you absolutely have to take magnesium and zinc, and you probably will have to take more than what the label says, just in order for you to get some level of absorption for it. So that is crucial, especially with minerals. If you think about magnesium, now you're taking your PPI, but you have trouble sleeping. Why? Magnesium helps with sleeping. Take a PPI if you're a guy and you start having a testosterone level that is low, you're not absorbing your zinc. So those are my two favorite minerals that I talk about every day. But PPIs really diminish their absorption so much that you really can't get any benefit from it. But the minerals is only one of the problems. There's also another cholesterol medicine. We talked about the statins earlier. So there's a cholesterol medicine that they call the sequestrants. Fenofibrate is one of them. And we talked about the CoQ10, but fenofibrate also gets rid of your vitamin E. And what does a vitamin E help for, Yvette?
Well, your vitamin E is absolutely essential. If you just look at heart health, you look at your blood, you look at your hormones, you need vitamin E. That's your fat-soluble vitamins, A, D, E, and K.
If I remember correctly, that the A, D, E, and K is all four of those vitamins are diminished by fenofibrate.
That's right. They don't get absorbed because some or other person decided that if you take a drug that binds to the fat in your diet, that it's going to make you healthy. If you think about it, just common sense, think about it, it doesn't make sense. And that's what it took us from going to, oh, okay, we'll give that to why? Explain to me again. And something else that with the BPIs, it's really crucial. And many people will say, oh, it can't be this drug causing me problems. I've been using it for years. Well, that's the exact problem because of years and years and years of that acid production being stopped or inhibited. You are not absorbing minerals, magnesium, potassium, sodium, zinc. I mean, you can go down the line. And then on top of that, one of the biggest side effects, and that it says clear as day in the literature, is vitamin B12. So all of a sudden you get all these women that now they're getting tired. Now they start taking a vitamin B12, which that's a story of a whole nother day, which will explain to you how to take vitamin Bs. But to just supplement with a B12 is not going to help at all. It's not going to really get you back to where you were. You've got to go to what the original problem was. And anemia can lead to some really serious health conditions. And most people don't take it serious. And another problem I come across a lot, because what you were saying earlier on with the people with the added drugs, one of the things that a lot of people struggle with, restless leg syndrome. Now, if you've ever had that, you might think restless leg, your legs are a little bit restless. No, believe me, it's far worse than that. It's not being able to sleep. It's legs twitching, moving uncontrollably. When you go back to long-term use of the PPIs, it's because there's no minerals. So as soon as you start looking when they started using that, and it can be 3 months, 6 months, a year before that develops. And one of the most crucial statistics that I always quote to people. In Sweden, I think it's around about 2008, they did a study that showed that every year that a patient is on a PPI, it increases their risk. So let's go back. Every 1 year that they are on a PPI increases their risks for bone fractures with 30%. Why do we have so many hip fractures, bone fractures, people falling? And the ages are getting younger and younger. So in a nutshell is the other drug that causes a lot of nutritional deficiencies. Only adding the drugs, the supplements back doesn't really help you. If you can understand that where Johann and I are at the point where we want to see, but why are you having this? Instead of giving you a higher dose, because a higher dose doesn't always mean double the side effects, sometimes can be 3 times. So when you look at where we are aware of what nutritional deficiencies it'll be, we want to make sure we can get you completely nutrition sufficient, but then get off the PPI. So
Absolutely.
that is our train of thought.
And I was just thinking about the PPIs, and I don't want to beat a dead horse, but I was just thinking, remember we talked about the progression of starting with 1 pill and then 2 and then 3 and then 17 at the end?
Yeah.
So since the PPIs block these minerals, that is essential for so many things. I mean, magnesium plays over 400 in your biochemistry. That's a lot. So if you
That
don't
is.
have the magnesium, it's 400 things in your body that's not going to work optimally. We also talked earlier how important these minerals are for blood pressure control. So now, just because you have heartburn and the doctor said, well, let me give you this pill, it works great, and you take it, yes, and your heartburn is gone right away. But now you have to keep on taking it. I think you've heard of this, where they call it purple pill syndrome. It started out with the invention or the market launch of esomeprazole.
Nexium.
Yep, purple pill syndrome, because these people, if you're on these long term, and another thing, if you go read the literature, it says that from the manufacturer, they don't suggest that you take it for longer than 2 weeks. And how long are people taking these? Some
Years.
people lifelong. And then they'll tell you, I tried to stop this, but I can't. As soon as I stop it, the heartburn comes back with a vengeance. And that is purple pill syndrome. Now, there are ways that we can help you in our practice to get off of it.
Yeah,
but
that's one thing I wanted to say. We've got to make it very clear. Please don't just stop them.
yeah, no,
You'll feel
be
like you're having a
sorry.
heart attack. So
Yes.
please don't do that. No.
And according to our disclaimer, also, we don't want you to change any of your regimens without talking to your doctor first. So just to put that out there. But talking with purple pill syndrome is one thing. But if now you don't have your minerals, now your blood pressure goes up. There comes your second pill. Now it affects the blood pressure pill. Also, especially if it's the ACE inhibitors, also going to affect your minerals in another way. It's going to affect it in your kidney, where you're going to lose more of it. So it's like one thing just adds to the other. So I really think, when it comes to medical sciences, there's many ways to be sick, but there's one way to be healthy.
When I think of our name of our podcast, From Pills to Purpose, and so many people have questions and they don't know where to go. Johann and our aim is to show you that there are better ways, that this could possibly be something that you're experiencing and you didn't realize it's that drug causing it. And the reason why we want people to be purposeful is you have to take care of yourself. It's no longer the doctor's responsibility, it's yours. And this is the one, we can probably talk a whole hour on this topic, which we won't cover all of it now. But the long-term studies for the PPIs that came out in 2016, 17, 18, and the correlation between that and dementia, cognitive decline. And this has become a serious, big problem. My own mother passed away due to dementia. So I know out of personal experience how those things led onto it. So that's another avenue. And we found lots of people with questions like, I don't want to be on this because I can already see cognitive decline. How can I reverse that? So when we talk about pills to purpose, it's honestly taking a hold, being aware of what you are on. And that's why I'm saying when I ask somebody why you're taking certain medications, I really think you should make a plan to find out why. Why does the doctor prescribe this to me? When you see them the next time, said, what is the reason for this? Ask the right questions. Because without asking the right questions, you're not going to know where you're going to head to. If you just blindly accept it all, take it all, and 5-10 years down the line, you're having all these issues, and now all of a sudden you're showing interest. And what you were saying, Johann, earlier on about people are so worried about lifespan, but nothing about a health span. Do you want to spend the last 10, 20 years of your life going from doctor to doctor to doctor? Or would you rather take a hold of what's going on now, being aware and you don't have to have a medical degree. You can just focus on what your stuff is. Learn a little bit and you will have purpose in your life in the sense of you will have time to live and not to just go from doctor to doctor. So I want to make it very clear that our whole purpose here is to teach you.
Yes.
If you don't know where to go, we want to teach you. If there's subjects that you feel that you can't find information on, we'll have a look at that. But it's very deep in my heart when I speak to people and they break down crying because nobody's ever been able to listen. And that's what we want to do.
And I want to add, I really feel health is an investment. Remember, we did a training where the person said, remember, your staying healthy is like printing money. Remember that?
Yeah.
And it is really like that, And how do you just, when you put money in your 401k, do you just throw it in a big old pillow and don't care what the fund manager does with it? Or do you periodically go in and see which funds there is, which outperform others, which are not performing that were performing in the past? Well, I do. I go and I look at my at a minimum once a quarter to see which funds I'm invested in now that is not performing as it used to and where I can move it, where it can better perform. The same thing is with your health. You can't just go from doctor to doctor thinking they know everything they're doing and don't take any personal responsibility for your health. Remember, the healthcare team, the pharmacist, the doctor, the lab, the whoever nutritionist, all those people are your employees. You can fire them whenever you feel like it. I don't suggest just firing them and not have anything, but I would say educate yourself and then ask, like Yvette said, ask the right questions. But if you know what's going on in your body and how things actually work in your body, you will know which questions to ask. And I want to say, when you ask a question to a doctor or pharmacist and they tell you, don't worry about it, just take this pill, turn around and run.
It's just horrifying that the age group of people that I work with mostly are over 65. Majority of them live alone. I know for a fact that there is complete wrong taking of their medicine. They're taking it at the wrong time. They're taking too much stuff. They have no idea what they're doing. And I feel that we want to talk to the generation that is going to be heading towards that age. Be aware. Know what's going on. Be proactive. Don't be the one that's, when you're 65 or 80 or whatever, now all of a sudden you're asking questions about your health, because really health is your biggest wealth. That's your best investment ever. And by understanding how the body works versus just, is there another pill? And I think that's probably one of the comments that I want to run away when somebody says, I'm sure there's a drug for that. And I'm thinking, you can also change your lifestyle. You can possibly eat less sugars, carbs, processed foods. There's a wealth of things you can do. All you want to do is throw a drug at that. And it really does show where a lot of people's train of mind, their thoughts are. They so sold out to the fact that somebody else is going to take care of my health. No, they're not. Like I told you last week, the doctor doesn't go home at night worrying about you. He worries about his family. How's he going to pay his mortgage? How he's going to do stuff. Same with the pharmacist. So you have to take personal responsibility. And the only way you can do that is if you have a plan. And the plan is, find out, why am I taking certain stuff? What is it doing? And if you need be, Johann and I are always very willing to go through drug interactions, looking at counseling, getting you off certain things, advising on certain supplements. So that's where it starts. It doesn't necessarily mean where it ends, because it can be so much better. Like you were saying, Johann, you feel better now than you felt 10 years ago.
For sure. For sure. And all that took, it was actually, I first improved on I was doing the exercise already to some extent, not the right exercise. There's another thing coming down the line, we'll still get there, is doing the right type of exercise. But diet has a lot to do with it. And when you talk to any functional medicines person, they always go to diet, gut health, all that type of things, because that's where it all starts.
And my favorite saying, sorry to interrupt you there, is you cannot out-exercise a bad diet. And I work with elderly people, and the first thing the doctor says is, oh, you should work out more. For heaven's sake, they can't even get out of bed.
Yes, that's absolutely true. Absolutely true.
And it's extremely it's heartbreaking when you're trying to feel better and trying to do better, and they tell you to do something that is basically impossible.
Yeah, I have to just throw this quick one in. I go to the gym 2:30 in the morning. There's this lady who hired a personal trainer. She's there at 4 a.m. every day. And she's, from the looks of it, if I see her next week, I'm going to ask her, because I'm pretty sure she's in her shape.
Wow.
So hats off to her. But that's a thing. If you start just doing the right thing, one thing at a time, pretty soon you will realize, and your doctor will realize, that you don't need all these medicines anymore. And say, oh, your blood pressure is normal. You feel dizzy because your blood pressure is going too low. So stop the medicine. So just doing the right things at the right times and the right type of things, like we said about the medicines. And your body will heal itself. Your body is an amazing machine. It will do exactly what it has to do if you give it the right stuff.
And another demographic that I deal with quite a lot is the younger people, the ones in their 20s. And one thing I see from them that they all say, I do not want to be sick like my parents and my grandparents. So we have the demographic of the people that are on a lot of medication. They need education and a way to get them healthier. Then we have the young people that said, we're not going that road, but they need the right information. They need to know how to feed their body. They need to learn about nutrition. And again, what you said in the beginning of our podcast today, there's a lot of people that you go to pharmacy school, you go to medical school, all that, but you've got to start looking at who paid for that education. I'm not talking about your parents and that. I'm talking about the actual institution. What was their method and their thought behind it? Johann and I are very fortunate that we went to a university with Christian ethics. It wasn't funded by pharmaceutical companies, and we literally were taught zoology, botany, biochemistry, the basic things. Nothing was influenced by the drug manufacturers. And a lot of it is over here in America, and we've seen it. We've noticed it. Once you start seeing a change in the education, then you'll see it'll go through to the younger people. But unfortunately, we're probably about a few generations out for that to happen. So the young person, the one who's not on the medicine, the one that doesn't have that deficiency, that doesn't want to go on there, that's the people we want to talk to as well. Because we don't want you to be from pills to purpose. We want you to have a purpose to never get to pills.
Absolutely. Absolutely. You know my favorite verse in the Bible, John 10:10, that he came to give us life and life in the fullest. And many times I feel people need to ask themselves, what does that really mean?
Mm-hmm.
Now, if you're all broken up and you can barely move, is that really living life to the fullest? I had to do a vaccine for a gentleman just yesterday. And he is elderly, so I give it to him. But he came in and it took him at least, I would say, about 30 to 40 seconds to get in the chair, and almost again the same amount of time to get out of the chair. And you could see when he got up, he was walking like a question mark. And I thought to myself, that's the reason I'm going to the gym at 4 o'clock in the morning. I do not want to be that person when I'm his age. So people need to listen to that, the health span and lifespan. I've got several customers who's over 90 years old. They're heading towards their 100s. How do you want to spend that time?
They call it the golden years. For some people, that's not very gold, but how do you make it the golden years?
Absolutely. I would rather live a happy, healthy life doing everything that I love at that point and just drop dead one day because my time came, rather than going from doctor to doctor to doctor, not being able to go on a vacation or take my wife to the beach because I have to schedule another appointment, or I simply don't have the energy or the power to do it.
Yeah.
So think about that. Do you want your health span to match your lifespan?
And I have seen, and you and I have both, the age of people going onto chronic medication is dropping drastically.
Yes.
So me growing up, you growing up, I never had friends in their 20s that were on blood pressure and heart medicine and diabetes stuff. And nowadays we see it in the teens. It's going down younger. So my heart goes out to people like that, because deep inside, and I know I'm dealing with one patient now that at the age of 26, highly depressed, extremely unhappy, and with me walking through with this patient, through obstacles. Literally a week ago, she said, I thought I was crazy. I thought I was losing my mind because nobody was helping. And that's where we are. And in a society where you just got to smile, it's got to look good because, it's social media, it's Instagram, it's take your pictures, everything's so good. But in the meantime, you hurt. You're having struggles with your mind. There's so much pressure on your actual physical body because we work long hours. The Americans are not known for going on vacation a lot. People don't take off. So you've got to be honest with yourself and ask yourself, am I really feeling the greatest I am? I know lots of people that'll say, yes, I am. And you ask them 3 questions and like, hang on, no, I'm not. But we're so used to what is normal. We get sold on what is normal. It's normal that you're getting old, Johann. It's normal that no, it's not. Who told you that? We're supposed to live a life exactly like God said, to the fullness every day.
I 100% agree. But I think this was great. I think our listeners have a lot to chew on. And I really hope that this episode will inspire the people to think about their own health and the role that they have to play themselves. Because there's much more to health. Everybody's looking for the silver bullet. There is no silver bullet. The only silver bullet there is the responsibility you take for your own health outcomes and wellness and well-being.
Well, I'll say this again. I said it last week. You are your highest priority.
Yes.
Nobody else is going to take care of your health and your life as good as you. So if this is a concern, if this is something you want to flourish, then you've landed the right spot.
And we want to leave you with our slogan. We really hope that these are conversations that is going to move you from medicated to motivated.
That is super. Johann, I love it. And hopefully we will get to speak soon and discuss some more topics. And if anybody has any, requests or stuff, they can always forward it to us. That would be wonderful.
Absolutely. Leave a comment, rate our podcast. That is very important, that it keeps us on the air. Rate our podcast and share it with your friends. If you know somebody who needs information like this, just share this podcast with them. I'm very confident people will thank you.
Yeah, and just for us being new at this, for people to get to know us, our big thing is for you can understand our heart. Later on, more, if you have specific questions, we can go in depth. We basically feel we want to let you understand where we're coming from so that you have a feel for what our whole train of thought is. And as we go down the line, we will delve deeper into things to help you further.
Then, all right. So that's from us. Until next time, take care.
Take care. Bye.
The views and opinions expressed on this podcast are our own and are intended for educational and informational purpose only. This podcast does not provide medical advice, diagnosis, or treatment. The information shared should not be used as a substitute for professional medical advice from your personal health care provider. Always consult your physician, pharmacist, or qualified health professional before making any changes to medications, supplements, or health regimens. We are also promoters of Neolife nutritionals, beauty, and household products, and this stems from our knowledge of their purity and the company's reputation to provide products of outstanding quality. While we may discuss our experiences in the retail pharmacy setting and share insights into functional medicine, our conversations reflect our professional perspectives and personal opinions, and not those of our employers, affiliated organizations, or licensing boards. By listening to From Pills to Purpose podcast, you acknowledge that you are responsible for your own health decisions and agree that the host and guests are not liable for any outcomes resulting from the use of the information discussed in this podcast.